Hello.
Hello.
My name's Logan. I'll be your nurse today.
Okay.
We're going to do a physical assessment if that's okay with you.
Yep.
Go ahead and wash your hands. Can I have your name and date of birth?
Mackenzie Marks, 4/17/99.
Okay, that matches. Any allergies?
Nope.
Okay, can you tell me what today's date is?
October 15th.
Okay, do you know who the president is?
Donald Trump.
And do you know what town you're in?
Madisonville.
Very good. Patient is alert and warning ×3. We're going to go ahead and get a set of baseline vital signs if that's okay.
Mm-hmm.
Does it matter which arm we do your blood pressure in? Okay, blood pressure 120/74. Respirations are 18. Are you in any pain today?
No.
So 0 being the least, 10 being the worst, would you say you're 0?
Yeah.
Okay, we'll go ahead and get your pulse. Okay, pulse is 72. We'll go ahead and wash our hands again. We'll put our gloves on. If you would, pull your sleeves up for me. Been telling this hospital to stock us with bigger gloves. Budget cuts, you know how that goes. Okay, so we're going to assess your skin. It is warm, dry, intact. It's appropriate for ethnicity. We're going to do capillary fill, less than 3 seconds. Go ahead and do skin turgor, resilient, no tinting. So now that we've assessed your skin, we're going to move to your head. It is appropriate for body size. It's symmetric, it's equal, it's round. We'll go ahead and take a look at your scalp here. Okay, no lesions, no abrasions, no abnormalities noted at this time, no dandruff. So while we're here, we're going to go ahead and do your frontal and your maxillary sinuses. Just tell me if there's any pain noted.
No.
Okay, so no pain, no redness, no edema noted at this time on the sinuses. We'll go ahead and do your temporal. Okay, pulse is a 2+. So her external structures, external features are intact and appropriate. Eyebrows, eyelashes are appropriate for her ethnicity. So let's go ahead and take a look at your eyes. Before we do that, would you mind smiling for me? Frown, puff out your cheeks, stick out your tongue. Very good. Cranial nerve 7 is intact. Okay, just go ahead and look at this pen. All right, now I'm going to go with 6 different gazes. You just look at it with your eyes. Okay, very good. Just look straight at me. And look in each eye. Okay, so pupils are pearly, equal, round, reactive to light. They are symmetric. They are accommodating. Her eyes are a size 4. Cranial nerves 3, 4, and 6 are intact because we did the 6 cardinal gazes. The sclera is white and the conjunctiva is pink and moist. So let's move on to your nose. Just go ahead and look straight at me. Okay. So from the outside of her nose externally, I can see no deviations, no abrasions or abnormalities. Go ahead and look up for me. Okay. The nasal mucosa is pink and dry as it should be. There's no tumors, no abnormalities, no lesions. Like I said, it's dry. Would you go ahead and blow? Blow out this one. Okay, so the nares are patent. There's no septal deviations noted. I'm gonna have you do a smell test. Cover one nostril. What do you smell?
Alcohol.
Very good. Cranial nerve 1 is intact. Okay, so now we've done that, let's go ahead and move on to your ears. Okay, so the ears are symmetric. Externally, there's no lesions, no bruising, no battle sign noted. And also, there's no buildup of earwax, there's no drainage. Like I said, they are symmetric. I'm going to go ahead and do a whisper test, so if you would cover your left ear for me and repeat the 2-syllable word I give you.
Baseball.
Very good. So she repeated it back. The whisper test is complete. That's cranial nerve 8 is intact. So now that we've done that, we're going to move on to the oral mucosa, oral cavity. Go ahead and open up, say ah, move your tongue up for me. All right. So the oral mucosa is pink and moist. All 32 teeth are intact. There's no dental caries that I can tell. Her tonsils are a 2+, and if you would, go ahead and swallow for me. Stick your tongue out, up, down, left, and right. Very good. Okay, so cranial nerves 9, 10, and 12 are intact. If you would, shrug your shoulders for me. Very nice. Cranial nerve 11 is intact. So now we're going to look at your neck. So we're going to check your carotid pulse. Okay, that's a 2+. Trachea is midline. If you would, do all the way around for me. There you go. She has full range of motion, no hesitancy, no resistance noted in the neck area. Now what I want to do is I want to take a look at your upper extremities. And when we're assessing one throughout this entire assessment, we would do everything bilaterally. So, like I said, her upper extremities are symmetric. They're even, appropriate for ethnicity, like we said earlier with the skin. I'm going to go ahead and have you rotate your shoulder. Okay, now your elbow. Now your wrist. Very good. So, no crepitus noted in the joints. Range of motion has full range of motion. No resistance, no hesitancy noted. If you would, go ahead and put your arms like this. Hold. Now push. Squeeze my hands. Okay, so she has a +5 muscle in the upper extremities. We're going to go ahead and do your radial and brachial pulse while we're here. So we'll do radial first. Okay, it's a 2+, and we'll do brachial. Okay, very good. That's a 2+ as well. We're going to go ahead and go to breath sounds. We'll start in the front, and just while we're assessing her chest, is there any tenderness in your chest? We notice there's no JVD or distinct neck veins noted either. So would you go ahead, I'm going to put my hands on your back, breathe in and out. Okay, so respirations are even and non-labored. With breathing out and breathing in, it's a 2-to-1 ratio like it should be. Normal breath pattern. We'll start here. We'll go 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. Then you go to the back. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, and 9. So, no adventitious breath sounds noted, no wheezing, no rhonchi, nothing of the sort. So breath sounds sound good. All right, so let's go ahead and move on to your heart sounds. We'll start on the right right sternum, second intercostal space with aortic. Then left sternum, second intercostal space, pulmonic. Then Erb's point is at the third intercostal space. Then tricuspid at the fourth intercostal space. Got that for me, thank you very much. The fifth intercostal space, midclavicular line, is your apical pulse or mitral. And we're going to listen to this for 1 minute. Okay, her apical heart rate is 74. S1 and S2 are noted. No S3 or S4. No ventricular gallop. Also, there was no arrhythmias noted either. So heart sounds are sounding good. While we're here, go ahead and do this for me. Touch the tip of your thumb with each finger and then reverse. Very good. So your fine motor movements are intact. Now that we've done that, can I have you laying on your back for me? So first we'll assess. It's flat. There's no abrasions, no bruising, no abnormalities noted just upon assessment. After that, we will also take the bowel sounds. We'll start on the right lower, go up, go over, and then down in an N pattern. Okay, so normal active bowel sounds are noted. And then what we'll do is we'll percuss, same order. Okay, so no dullness, no rebound pain noted at this time. And then lastly, we'll palpate. So we'll lightly palpate the abdomen. Any tenderness noted?
No.
Okay, very good. So now that we've done that, we'll have you go ahead and stay seated for me. Can you tell me your last bowel movement?
This morning?
And are you having any urinary problems?
No.
Very good. So while we're here, can you go ahead and flex your hip for me? Now up. Very good. Now can you do your knee? Okay, now your ankle. Very good. So you can sit up. So we know her, she has full range of motion, no hesitancy, no resistance noted, no crepitus noted to the joints. There was no edema noted. Her legs are symmetric. And like I said earlier, everything we do today is going to be bilateral. We do it on both sides. So what we would also do is I'm going to have you push against me. Now pull. Now push down. Now push up. Very good. So the muscle strength in the lower extremities is a 5+. That's good. That's very strong. We're going to do the dorsal pedis pulse. Okay, it's a 2+. Then the posterior tibial. That's a 2+. On the feet, there's no abnormalities noted, no fungi, no bunions, no bruising or breaks in the skin. Bottom of the feet look the same. Bilaterally, they both look good. So your feet look good. So also while we're down there, we would do cap refill. Cap refill is less than 3 seconds. So while we're here today, is there any other medical concerns that I could talk with you or talk with the doctor about? No pain, nothing of concern?
No.
Very good, very good. So what we would do now is we would take our gloves off, we would wash our hands, and we would document appropriately. Thank you very much, Ms. McKenzie.
Thank you.
All right.